Good afternoon, everyone. On this August 5th of 2021, I'm Mayor Diana Broderson, and welcome to our city. We have with us today the Director of Public Health for Muscatine County, and we're so excited to get some updates and news that impacts our daily life when we're talking about the pandemic, which is right there with us every day right now, unfortunately. Before we get to Christy, though, I'd like to just share a couple of brief announcements. First of all, at 7 p.m. on Sunday, if you can make your way over to the Susan Clark Junior High, they're going to be ringing the bells. We have a relationship, a sister cities relationship with Ichikawa Masato, Japan, and we have for quite some time. And we join them each year in celebrating peace. And this year, it's going to be 76 years of peace since the Hiroshima and Nagasaki bombs were dropped. So grab whatever bell you like. They do this every year, and bring it with you and go to Susan Clark Junior High, and they just stand and ring the bells for peace. And I know you will be quite rewarded if you have an opportunity to do that. Secondly, I would just like to share with you that August 12th, we have a wonderful opportunity. WHBF goes down to different cities in the community periodically and does what they call Local 4 News over coffee. And they are meeting with several different mayors to talk about how their cities have navigated through the pandemic, how they've been impacted, how they've been resilient. And so we have a wonderful opportunity to let our city shine right here on the news for other communities to see. We always know how great Muscatine is, but sometimes it's really nice to share that with others. And lastly, please make sure, we're working on this railroad project of making sure that the railroad crossings aren't blocked longer than they should be. So if you are blocked longer than 10 minutes at a railroad crossing, please look up on the pole. There's a number there, and there's a phone number to call, and then there's also a number that tells them which crossing you're at. Please call that number if you're there longer than 10 minutes. That gets logged into a database, and then that gives us information that we can use as we move forward to try to reduce this problem for folks that are trying to navigate around the city. So without further ado, I would like to have you join me in welcoming Christy Roby-Williams. She is the Muscatine County Director of Public Health. She's been at the helm for quite a while now and has had a really tough job trying to see us through this pandemic. Welcome, Christy.
Thank you, Diana. Thank you for asking and inviting me to your talk.
Oh, I'm so glad that you were able to join us. And as we were saying, you've been on the list of the schedule to come today for quite some time. And I had hoped and thought, well, I can't have you come, when you're so busy. So hopefully it'll all be over by then. But unfortunately, that's not the case, is it?
No, it's not. The trajectory is headed back up.
Oh,
thanks to
goodness.
The Delta variant. Yes.
Nobody wants to hear that.
I know. It is sad. Yes, as we were talking earlier.
Yes, it's terribly sad. And what scares me the most, and I suppose a lot of us, is we all have youth that aren't even able to get vaccinated yet. What's the best thing that we can do to protect our youth that aren't able to get vaccinated?
Yes. So the CDC recommends, and the CDC is our one true source for public health and the Iowa Department of Public Health. And so the CDC recommends for children ages 2 to 12 or 2 to 11 to wear masks when they are out in public settings. Those that are 12 and older can get vaccinated. And we would love to see our numbers increase. I think we're doing well as a county overall. But we can do better and getting those vaccine rates up.
We always like to think that Muscatine is better than everyone else. And so this is a place, we can actually use hard number and prove it.
Yes,
so that's right. Keep those numbers up.
That's right. We're at 58% of our eligible population. So that's 12 years and older. So we've really gone in and looked at the data and pulled out 12 and older and removed 11 and younger. And we've got 58% of people 12 and older that are fully vaccinated. That means they've had their 2-dose series or their single dose and post 12 or the 2 weeks post vaccine. So
a lot of people ask me, so the 58%, Is that of everyone or just those that are eligible? And the way I explain it is they've already, you like you said, you've already taken out those 12 and under, right?
We've taken out, yes, the individuals that are 11 and younger. This is how we pull the data is for everybody 12 and older. So those that are age eligible,
Okay.
58% are fully vaccinated now in our county.
Okay. So we can still get 46% more? No. Or 42? No.
Point of those that are eligible, we have 21% of county residents that are eligible, they're age eligible, that could get vaccinated.
Okay, gotcha.
Yes.
All right. So we've got some work to do.
We have a little bit of work to do, and there's a lot of community collaboratives going around right now. Diana, you're a part of that, and it's really around the space of health equity, because we know there are people throughout our county, in our city, that do want the vaccine, or maybe weren't quite sure, but now ready, but they may not be able to get to the vaccine. Their work shift maybe is as challenging for them to be able to access it. And so we want to know who those folks are, and we want to work with them to try and get them the vaccine. If individuals are homebound, we'll go to their home. Public health will go to their home and deliver a vaccine directly to them. Senior Resources is working with us, and we're working with non-emergency transport, and we can actually help people get transported to pharmacies, their doctor, or public health for free.
Because there really are a lot of places that you can go, right?
There are, yes, yes.
So you've got pharmacies?
Yes. We've got all pharmacies in Muscatine County, so all of our Hy-Vees. We have several Hy-Vee pharmacies. We have Walgreens, Walmart, Webster Drug. So we are really rich in resources and locations in our county. We're very fortunate. As other counties rolled out vaccines, not many had partnerships like Muscatine County did with pharmacies and doctors' offices. And we've partnered with all the doctors' offices to also give them vaccine. And then public health has vaccine. So it's very accessible right now.
Yes. Or can you even go to your regular, well, you know, when you go to your doctor appointment, can you get one?
Some of them still have vaccines. Okay. Some of them may refer you to a pharmacy or public health. Okay.
Now I have some goofy questions. So I had someone who said that they have had questions in the past of maybe they were having reactions, and so they're scared. So they want to have theirs not at a pharmacy because what if something happened? Sure. Is our community making allowances for, if people just want that extra assurance that a doctor could be there? So could they get it at the hospital or somewhere where they feel a little more safe just till they get through that danger zone of the first 10 minutes?
Yeah, so I would say that even pharmacies, they are equipped to, the practice is sit and wait 15 minutes post vaccine. So after your vaccine shot, and they know how to respond to an individual if they're having some sort of reaction. Our reactions could be because of our anxiety, or our reactions could be a medical response. And so the individuals giving vaccines are trained to assess and acknowledge and then provide care or get to the right care to the person in that moment. And we've certainly had that, at public health. When we did vaccine large clinics, we have cots. And sometimes people feel more comfortable laying down after they've had a vaccine.
Sure.
So it's important, if people have had a reaction to getting a vaccine, consult with their physician first to talk it through with them.
But I really like how our community is doing a really good job, the health community, to meeting the people where they're at.
Yes.
So if they're having anxiety, if they're having questions, if they're having barriers, we're meeting them and helping them walk through that instead of expecting them to do it all the same way that we want everybody, like everybody has to do this. So we're really individualizing it. And I think that really is the key.
Yes, yes. And I will share, Dr. Meharry, works, he's a physician with the University of Iowa, hospital and clinics here in Muscatine. And He serves on our board of health as our physician representative, and he had a very good point, as he continues, his facility continues delivering vaccines to patients and individuals. The relationship you have with your provider is also very important, and that place and space is private. You can ask additional questions, and you have that interaction with your provider. So a lot of people find safety and security in that, and I appreciated that perspective from a provider to his patient.
Sure. I always tell people, when we're talking about health, and we do sometimes in our parenting groups at the Y too, I always tell people, I think the best thing that you can do for your health is to have a permanent primary care physician that you have a relationship with, because they come to know you, they come to know anything new, you come to trust them, but having that relationship with your primary care physician, I think, is the key. I really do. Bouncing from doctor to doctor, or just going to urgent care or emergency room for care, you are missing the biggest chunk of healthcare, in my opinion.
Your opinion is spot on with what the healthcare world and research and science says and in public health, we're preventing, we're promoting, and we're protecting the public. Prevention is having a primary, you may hear, somebody might hear a primary care provider. Well, what does that mean? That means a doctor, could be a nurse practitioner or a doctor, a medical doctor. And that's not express care, and that's not the ER, although it is okay. Those are important parts of our health system for those out of normal time and normal hours. You got to take a sick kiddo. I had kids, they were little, I had to take them outside of those normal hours. But you're absolutely right, Diana, having that relationship with a primary healthcare provider or doctor all of the time provides consistency and helps keep you the healthiest.
Yes.
Yeah. So, thank you for speaking to that. And if people don't have one or they don't have insurance, they can call public health. We can certainly help connect them to those resources.
And I don't know how they do it, because they can have thousands of clients, but they still remember you.
Yes.
And they remember your body, and what this is different. This you didn't have this before, and I don't know how they can remember all that about each and individual one, but that's been my experience.
Yes, mine as well. Yeah.
Yep. And I've been fortunate with that. So back to the vaccines, we've got to get more people vaccinated. Do we really believe, we have more and more mandates coming up, more and more restrictions, back to social distancing, continue, with the hand washing, and in many cases back to masks. But do we really believe that vaccinations is what's going to get us through?
So based on the science, based on the information that we've received from CDC and the Iowa Department of Public Health, when this pandemic first started, the only mitigation efforts we had were those precautionary measures you just mentioned. And I always have to flash the mask, is the masks, the social distancing, the staying home. If you're ill, stay home. That's all we had. And so that's what we preached and teach. That was our only preventative measure and protection from the public. We know vaccines to be effective. Look at polio. We know they're effective. We know they can work. We have to have a high percentage of people receiving that pharmaceutical intervention, that vaccine, along with the other pieces. That's why we're starting to pull in the other mitigation efforts, because we don't have enough people vaccinated. Our regional epidemiologist, they study this every day. She's like, we're going to continue to have variants as long as we have people that are unvaccinated, because viruses are smarter than all of us, and they're going to figure out how to stay alive.
How much so we have about 58%, is that correct, in Muscatine County of the eligible people fully vaccinated?
Yes.
How much do we need?
We need 21% more of people to go get fully vaccinated.
Okay.
And so, I don't have a raw number for you right in front of me of what that equates to, because I got to pull out the 11 to 0 age group that's not eligible. But we can pull data apart. We can see within zip codes throughout the county. And we know we have some work to do in some communities. Some communities throughout our county have exceeded expectations, and others still have a little ways to go. And so small rural health equity is what we're focusing on in those spaces. And so we're taking mini vaccine clinics to those communities and offering it to them. Working with other pharmacies to go out and do the same thing, because we've got to take the vaccine, as you said, Diana, to the people to help encourage more vaccinations. I know there's a big Farm Bureau event coming up. We're going to partner and be present at that. We're working with Pastor Yenner, with Calvary Church. I mean, there's just so many different events that we're going to keep chipping away at, have vaccine present for those that are interested in getting it.
What percent do you think is going to be a turning point? What percent do we need to get 80% vaccinated or 90%, or do we have to get 100% to make it this difference?
So that is a question I have also asked, and our epidemiologist originally said the sweet spot would be 60 to 70% of folks fully vaccinated.
Yeah.
I'm going to say probably higher than that at this point in time, but we're getting close. We're getting very close to that for our county. That is not where we will stop. No, we will continue promoting vaccines that are available throughout our county and taking vaccines to people to try and get those numbers up. Right now, they're just, when it first came out, there was really high demand and very little allocation. We got very little vaccine in our county. So it went rapid, it went fast. And now we've got all this vaccine and we're trying to find people that may still want it and need it, but have not been able to get to it.
And I think our county is doing amazing. One of our daughters lives in Bluegrass, and she doesn't know of one place in Bluegrass you can go to get a vaccine. And I'm like, and she said, Mom, I know a whole bunch of people there that aren't vaccinated because they don't drive and they mainly just stay in Bluegrass. And she said, we can't find one place. I mean, and I'm thinking, I said, well, that's not the case for Muscatine County because our county health providers go to Wilton and West Liberty and all of the little rural communities that we have.
Yes, we just had Wester Drug that agreed to go out to Mount Hillier.
Yeah.
You know, during a little event out there. We've gone to Fruitland, and we're continuing to map that out to get up to other small communities for that very reason, Diana, is we know there are individuals that live there that may not have the transportation or they don't like to travel outside of that small rural community. And so it's creating some rural health equity for our county members.
Sure. And that's been the key, I know, is making sure that it's delivered fairly. And that's what was talked about from the very beginning. We want to make sure that the higher socioeconomic groups don't get it before the other people do. Everybody should get it equally. And that's what I think is really key. And I really appreciate the work that Muscatine County is doing to make that happen. But it's not an easy task.
It is not easy. It has not been easy because the demand was very high. And we've been trained for this in public health. We've done this. I've been in the field for 8 years, and all of our emergency preparedness training has trained us for an emergency response like this. And we know that the demand and it would be very high. And those that maybe don't have the resources or don't have the transportation or don't have the connections in community would be the people that would not be able to get to the vaccine. So I actually appreciate how our state rolled out, creating some boundaries around how the vaccine would roll out to get to our highest, most vulnerable populations first. And if we look at and we dive into data, we can see that those are 65 and older are the highest vaccinated population in our state. That's a good thing. because they were definitely impacted the most.
Yeah.
And so, just continuing to look at that space and stay in that space. It's really important to all of our county residents.
So on this Delta variant that you just mentioned, we're hearing more and more that it's impacting and harming children more than the original COVID-19 did. So while COVID-19, when the youth would get it primarily, they had milder cases, but this new Delta variant, that's not the case. Some are hit quite hard.
Yeah, the Delta variant is definitely, it's a bit more aggressive in how it is being received in each individual person's body. It's spreading easier. So that's just a few things, indicators. I was listening to another colleague in the state, and they were talking about some children in their county that have COVID-19. And one was I would say preschool age range individual, and they had pneumonia. And so it's just, it is demonstrating that it's showing up a little bit more aggressively in children than it previously did.
That's terrible. That's so scary. Mm-hmm. And with school getting ready to start, it's quite worrisome for those youth that aren't able to get it yet.
It is. And it's the CDC's recommendation, and the public health department would absolutely stand behind the fact that schools should have mask wearing in the schools for all vaccinated and unvaccinated individuals. The reason why is that CDC is recommending that is really to help reduce the spread and protect individuals that are not able to get vaccinated at this point in time. It's a mitigation effort to help protect the overall population health. Mm-hmm. I know in our state that there is no mandate. Everything is just recommendation at this point in time, but we would highly, highly encourage children and employees of school districts to consider wearing their mask during the school day.
So even if it's not mandated that your child wear a mask to school, you can still choose to have your child wear a mask at school.
Absolutely. Absolutely. And I know people and friends that have said, that's what we're going to do. Mm-hmm. Now, whether, there's no one policing it, there's no mandate, there's nothing, there's no teeth behind that, but you certainly can. And adults can be an example of that as well in the schools.
Yeah. I've heard people complain about being vaccinated and now I have to wear a mask again. But I heard the other day Dr. Fauci talking and explaining why they would make a recommendation that people that are vaccinated wear the mask again. And his explanation was that this new Delta variant, they've discovered that even if I'm vaccinated, I could get the virus, but not be sick from it, but be passing it around to other people.
Yes.
And so that makes sense then of why you might be asked to wear a mask if you're vaccinated.
Yes, yes.
Because that's going to keep that spread down.
Right. And the virus will continue to modify itself.
That's true.
And there's another one coming next. It's called Lambda, and that's coming from the Peru area. So it will continue to modify itself to survive. And so we're putting in the additional precautionary measures that we started with, along with the vaccine, the pharmaceutical intervention, to really strengthen the approaches to reduce the spread.
And, I don't mind it. I was telling my husband, Roger, just the other day, he said, well, we're back to wearing masks. I said, yep, we are. And I said, but you know what? It's not like the first time. The first time we didn't go anywhere. We didn't do anything. Everything was shut down.
Great point.
I will happily wear a mask so that I can still go in the store, so I can still go drive somewhere that I want to go to.
Yes.
And still go to work and still have everything open. If all I got to do is wear a mask to not be shut down again, I think that's a small price to pay.
I absolutely agree with you. And the economic impact, of shutting down was much, much greater. And I just want to give you a quick shout out and thank you for your bravery and taking the stand when COVID-19, when we didn't have pharmaceutical intervention yet. You led the way for our county and in our state. There were a few mayors that did, and I'm proud that you are one of them, standing together at the City Hall and talking about the importance of it and bringing a doctor there to talk about the importance of it. It is the only tool we had to reduce the spread. And as you look at the numbers, you know, we have 106 people that have died in our county. We navigated a lot of those lives in the public health department. We became very connected to those people. We know what their health struggles were, and COVID-19 is what took their life. And so any efforts that we can put forward, speaking on behalf of the public health department, you know, we're protecting the overall health of the populations that we're called to care for. This, for me, in my core, there is no political connection. This is about the health of people. If you've ever spoke to anyone that's had polio, you know, devastating. And they are beyond grateful and thankful that the polio vaccine came about. We know it to be effective, and we are in a real life science experiment. We're learning as we go, but this vaccine, this mRNA, has been studied for 12 years. It didn't just get studied in the last year. There's a lot of science. I think I learned today as well, 98% of our Unity Point Health physicians have been vaccinated. They study science, they know the medical field, and they know the efficacy of this vaccine.
And I always think, my daughter was telling me, I thank you for your kind words, and I 100% agree with you that there's no politics in here at all. This is health, has nothing to do with that. To me,
Yes.
Never has.
Yes.
It has all been about doing what is best for the people's lives. But my daughter was saying that the other day. She said, Mom, when I'm trying to decide, you know, should I get my kids vaccinated that are 12 or older, or should I get this or that, or even, you know, what about the HPV vaccination? You know, she's like, she said, I asked my doctor, did you have your kids get it? You know, did you get it? Did you get your wife to get this? And she said, because they know this. They're not going to have their own families get this.
Correct.
If there's a danger. And so she's like, that's what I go by.
Yeah.
If they're having their own children get it, you know, that really says something.
That's a great indicator and a great question. I'm glad that I can relate to that, because I do the same thing.
Yeah.
We'll ask my providers, what would you tell your sister? What would you tell your mom?
Exactly.
Yeah, it is comforting to know.
It really is. You know, I've seen these stories lately on the news that just are heart-wrenching, of people that have chosen not to get the vaccine and have now contracted the virus and are laying in bed begging the doctors, please give me the vaccine. And the doctors are heartbroken. And the nurses, you know, their choice to not get the vaccine and go through this, they're not going through it alone. Their families are now hurt, their neighbors, their people they worship with, the doctors, the nurses. You know, it might be your choice in your life, but you don't live in a bubble. And so
it's a ripple effect of grief.
It is. It is. And that's not fair to the people that love you.
And I would say, you know, Diana, if there's any vaccine hesitancy around COVID-19, we also want to stand in this space as public health to provide the education and information. We want to empathize. We have Vaccine for Children program, and we have to educate parents and provide that information, and they have to make that decision, right, for themselves and their children. And so we have gone out and done consultations with individuals, provide education specifically for people that were homebound who maybe were like, I'm not quite sure if I want to do this. Our nurse has gone into the home, brought education, talked through it, provided that. We can do those consultations in community. We can do those consultations here at Public Health if there are additional questions that people have. We have amazing clinical team members, nurses that can help walk through that information with people.
And you know, on that same note, I love what you had just said recently, and I've tried to to talk about that with people that are saying, but this is brand new vaccine. It's all the whole main, the most of this vaccine has already been developed and used.
Yes.
They just added the Delta or the COVID-19 piece to it. So it's not a brand new vaccine.
Correct.
And I think that maybe that's not getting out enough.
Mm-hmm. Yes, and I also, the other thing information I have received is the emergency use agreement. There's some hesitancy because it's still under emergency use agreement. Mm-hmm. However, in understanding that, basically the FDA has approved it to a certain extent. Now there's more kind of pieces or bureaucracy that it needs to go through that for that final approval. Mm-hmm. I have heard, but I don't know it to be factual, that we're looking at this fall that'll be all of those pieces will have been reviewed. It's all in the legal documentation now. So I hope that gets pushed through, because I know that's a lot of voices and concerns that we've heard from our county residents, is that it's under that emergency use agreement.
You mentioned polio a while ago, and I remember when polio came out, and even when I was young, it was still fairly new then, and they didn't even have it in the shot form yet. They just squirted it on a sugar cube, and you ate this sugar cube. It was just get it into people. Mm-hmm. And but my dad said, when polio, they lined up in droves. Please give this to my child. Nobody ever even considered that it was political.
Yes.
Just save them.
Yes.
So one question that I have that I've had brought to my attention a couple of times, and I don't know the answer, is how do we know that the Delta variant is here instead of just the COVID-19? When somebody gets a test mm-hmm. for COVID, mm-hmm. do they run it to see which variant it is?
Yes. So any tests that are sent to the state hygienic lab will be tested for all variants. Okay. And there's several. Delta is not the only one. So they're testing them for all variants to see what is occurring in the state of Iowa. And when I spoke to, it was about a week ago, our regional epidemiologist, again, had mentioned to me that of the state hygienic lab test results, 80% were showing as the Delta variant.
Oh man, that's a high percentage.
Yes, yes. So it is absolutely. Now there are some labs that don't go to state hygienic lab, sure. And they may not be running that variant check on them, but yes, that is being done through state hygienic lab.
Wow, that's good to know though. Mm-hmm. So a couple of people have asked me, how do we know? Mm-hmm. Okay, so they're testing for that.
Yes.
Is there any other message that you'd like to get out today? The one that I was thinking was just, if you're having an event, if you're having a gathering, and you would like somebody there can they contact public health?
Give us a call. So when you say an event, so let's say, I don't know, there's a big fundraiser going on, or the Almost Friday Fest, for example. We will be at that in August here. But those are events that we are trying to get to, or we're trying to partner with some of our pharmacies to get to if we don't have the staffing available. So if there are large community events, cultural festivals going on, if there are individuals that are homebound, of a neighbor, okay. Let's say that needs the vaccine, they want the vaccine, but they can't get out and about. Mm-hmm. Have them give us a call. Okay. We will get the vaccine to them. And if there are those events, let us know, and we will work with our collaborative throughout the county to see who can cover those events.
Okay.
Yes.
Good. I can't say enough how awesome you guys have done to meet the people where they are, because otherwise you could just say, okay, well, we put it out there. If you want it, come get it. But you guys aren't doing that.
No. We know that not everybody can get to the vaccine, and nothing in life is easy, Diana, but we are committed to making it easier for folks. So if I just encourage, this is ownership of us as an entire county. If we know friends, family, neighbors, we know individuals that may want it, give us a call.
Yep. And I know you guys are working around. I mean, our grandson works and we're like, you know what? We'll come pick you up on your lunch hour. We'll take you, get your shot, take you right back. Bing, bing, bing. And
awesome.
And you make it work.
Yes. Yes, we do have walk-in clinics at Public Health on Wednesdays and Fridays.
Okay.
We have Pfizer and Moderna. So Pfizer is the one that we can give to 12 years and older, any age of adult. And Moderna is for anyone that is 18 years and older. We no longer have Johnson & Johnson. We've distributed and administered all of that. And the state is not giving us any more allocation at this point in time. We do have that Moderna and we do have Pfizer. Walk-in clinics, Wednesdays and Fridays, we're from 10 to 4. And then watch our Facebook page because we have different, as you mentioned, Diana, events that are going on. So last Saturday, we were at the Aquatic Center.
Oh, yeah.
Offering vaccine to 12 and older. And so we got some youth and adults at that event. We're trying to get into back to school events, festivals that are different festivals that are going on. So we have vaccine, pharmacies have vaccines, and doctors' offices have vaccine.
Sure. So Pfizer is 1 shot and 3 weeks later another. Moderna's 1 shot and 4 weeks later another.
You got it.
Okay.
Yes. Yes.
And for those of us that got Johnson & Johnson, people have asked me, well, why did you get the Johnson? Because that's what was available at that time when I got a call, and they said, don't be trying to pick and choose. Whatever they've got when it's your turn, that's what you get. So that's what we have.
Yes.
But there's talk about, maybe going in and getting a booster for Johnson & Johnson. Well, the CDC, I imagine they're keeping an eye on that, and they will let us know when they determine that we need something, if we need something extra. Is that correct?
Yes, if and when. And boosters are definitely a point of conversation. I listen to World Health Organization as they do their live broadcast, as well as, listen to CDC, IDPH. I anticipate that there may be a booster coming for vaccines, but we'll just stay tuned. I don't have any additional information on that. I've also been asked if I got Johnson & Johnson, should I also go get Pfizer now? Or should I go get Moderna? That is not being recommended at this time.
Okay.
Continue to stay with the vaccine that you have. And you're fully vaccinated if it's been 2 weeks after either the 1 dose or a 2-dose series. But because the Delta variant is running rampant throughout the United States, it's important, if you're going to go out in public, wear a mask. We do know Johnson & Johnson doesn't have the same coverage, vaccine protection as Moderna and Pfizer. So just proceed with caution. Everything that we do right now is risk, has risk associated with it. When we're interacting with folks, it's at a high community transmission level throughout our county and many counties throughout our state. And so that is the recommendation right now from the CDC is, okay, we've got vaccines, but let's put masks back into place as well when we're out and about in public.
And it doesn't have to be, so restrictive. If I'm going to a group thing, even a meeting or something, I wear my mask until I'm seated. And when I'm seated and I'm more than 6 feet away from people, then I can take my mask off.
Correct.
That's how I've been doing it.
Yes. And that is what that's because you follow the CDC recommendations, Diana.
That's because I don't want to get sick.
Right. And or pass it on to anybody else if you don't even realize you have symptoms. So yes, that is the recommendation is you can take your mask off if you're 6 feet away from an individual. And ensuring like eating and drinking activities, that's one that comes through our nose, right? And saliva. And so eating and drinking is a high risk activity. So if you're going to be in the workplace, let's say in a break room, try to maintain 6 foot distance while you're eating lunch.
Yep. And I've switched back to carry out more than
eating in.
Yeah. Or go into the places that have the outside.
Yes.
That's really
that's
nice.
Wise. Yes. The more we can be outdoors, continue to be outdoors, the better. I do know Florida, for example, right now it's kind of like their winter. not because it's cold there, but they're indoors seeking shelter from all the heat, and they're in air conditioning and enclosed spaces. So the more we can be outside and social distance, the better.
Yep. We try to have all of our birthday parties, family get everything outside.
Mm-hmm.
Yep.
Yes, that's wise.
Yeah, just safer. And you don't have to clean the house as much.
That's and when?
After they leave, yes. Well, thank you so much for joining us today. We really appreciate it, and everything that you do every day on our behalf. You know, I know you and your entire team are working day and night to try to keep ahead of this and keep us all as safe as possible.
Thank you, Diana. Thank you for inviting me. I appreciate you.
Thank you. Enjoy the rest of your day. And thanks to all of you for joining us. Next week, our guest is going to be Chief Evers with our Muscatine Fire Department. The second Thursday of every month, we try to highlight a different city department. And so the fire department's up next week. So please join us for that. Tonight, we do have a city council meeting at 7 p.m. Quite a lengthy agenda. You're welcome to join us virtually. And we hope to see you then and answer some questions that you might have. At the beginning of every meeting, there's an opportunity for people to talk to council. And so you're always welcome to do that. Thanks again to our guest, Christy Roby-Williams, Director of Muscatine County Public Health. Please contact them if you have any questions that we didn't answer today. I'm sure they'd be more than happy to address your concerns. Have a great rest of your day. Stay safe, and we look forward to seeing you here next week on Our City.